Dito sa NBN4. And first up, we have our representatives from the Community Health Education Emergency Rescue Services, or CHEERS Corporation. I have with me their President and CEO, Dr. John Alvin Montano. We also have Dr. Ahed Al-Najjar and Miss Sandy Montano. I was about to say, Doctor, good morning to our fine gentleman and lady. Let's talk about CHEERS. First of all, it's really for emergency purposes.
Yes, exactly, for emergency. But we also conduct trainings to prepare people to respond during emergency. That's
the thing. When you say preparing people for emergencies, first up is knowing the right numbers to call.
Yes, exactly.
Right? But this is an active participation, meaning you can save a life. This is beyond what? CPR? It's beyond... What exactly do you train people to do?
Yeah, we train people to, of course, respond in emergencies like performing CPR, basic first aid or other grades of first aid, and then perform advanced care if needed to do advanced airway management, intubate the patient, and perform defibrillation if needed for the patient.
And this is for the common citizen. You know, it's not like I should be a med student, or it should be like I have even college level. Can a high school student?
It depends. We have certain programs that caters to healthcare professionals like doctors and nurses. We also have programs that caters to lay rescuers or other professionals like lawyers, architects.
So anybody who would simply like to be able to help just in case something happens. Exactly. Let's define EMS. What is EMS?
EMS stands for Emergency Medical Services. Then it's a huge protocol and procedure carried under the EMS. And anything happen outside the hospital, we call it EMS, or pre-hospital care management. Anyone participating in the community is a part from the EMS. Through the public education, through the first aid program, CPR and AED program.
So that's actually an ideal state already, that knowing every community, but dito sa Pilipinas, every barangay level should actually have this in place. And unfortunately, that's not exactly what's happening. Right? So how do you solicit, volunteers? Or do you go from town to town? How do you spread your cause?
Actually, we begin by addressing groups of people requiring the training. For example, nursing students. It's their
requirements.
Yes, because there's a need, so it's easier for them to be convinced to undergo these certified trainings. And then after that, we go to LGUs, and then we make proposals to the mayor, upgrading or improving their EMS system.
Paano sila naiiba yung you already mentioned part ng nursing training.
Yes.
Pero sa mga doctors, kasi di ba there's interns,
yes.
There's what's above intern? Resident, residency. Is it related to that or no? This is a plus na lang or covered na kasi nila yun?
Well, it depends. Sometimes it's part of their requirement, and if already they are, let's say they have the training, it's a matter of improving. Or one thing unique about CHEERS is we offer international certifications.
Exactly. You have partners like the American Heart Association. Who else? Many affiliates.
I'm representing American Heart Association as a global regional faculty for the Middle East and Africa and Asia. And the role of American Heart Association is to enhance the CPR science and the ECC care. Any medical professional, if you say it from physicians up to the technicians, they need to go through short courses to enhance their skills about the science of cardiovascular diseases. Those courses need to be changed every 5 years due to researches, to statistics proven this wrong to give 30 compression, or this wrong to give 15 compression, or to increase them.
It's not technical,
Yes, yes.
Sure, yeah.
So all physicians, all medical team, they need to go for these courses in regular pace, which means every 2 years, because their validity is 2 years.
I don't know, with the way Dr. Ahed just actually described it, this is more than just breathe and pump 4 times and breathe. And it's not even just about checking pulses lang there. Those are very, very basic. This is, let's put it beyond like someone who's in an accident and you see like a shoulder limp, or actually biking accident. A lot of people think it's just dislocated, let's try to push it in. And you put it's already a smashed, the socket is smashed. So these things, you make it worse if you do not know what to look for,
Yes, exactly.
how to do things to make it better. Because so we see you as like the delivery guys between the hospitals or the doctors and between the area where it happened. So you're the guys midway.
Yeah, but it's going beyond as a delivery system. Of course, in our Philippine setting, typically, especially in the province, the ambulance system is just a transport system, bringing the patient on this point of accident, going towards the hospital. But to the true sense of EMS, there is already treatment being done, going towards the hospital. Even if you have the facility, you're already transmitting the data to a nearby hospital.
So they're prepared by the time you're
by the time they receive the patient, everything's ready. The doctor is ready. They already know the condition.
Versus questions upon arrival.
That would expedite the treatment for the patient.
Wow. Okay. So what about the actual training? How long does this take? 2-3 days or a weekend?
It depends on the program. There's basic programs and there's advanced programs. Basic program usually takes from 4 hours to 8 hours. It's a 1 day.
But that's basic.
That's basic. And usually run under medical team or public, or nearby public, community and workplace. We don't call them public, we call them community and workplace. They are involved in first aid program and CPR and AED. Now, for the medical team, there is advanced and there is basics. And usually it takes from 4 hours to 8 hours to up to 16 hours.
Okay. Because it's hands-on, huh? It's not lecture.
No.
You're not just sitting there. You really like, I believe you even go into emergency rooms. That's part of your training?
American Heart Association, they enhance the way how they teach the modules. They adapt a new module called practice while watching. There is so many evidence that practice while watching shows enhancement, self-confidence for the student.
Of course.
It's become more better than before. And now, currently, American Heart Association in November, this coming November, will do something new. We call it roll out, new guideline. Every 5 years, we do new guidelines.
So you're always updated.
Yes.
Always new technologies, new ways of improving.
So we are working on this 2005 guideline until now. In this coming 2010, in November, we'll be on for the next 5 years.
Wow, okay. So if you can hold on until October, you get the new program in November.
We can work on the old program until we are releasing the instructor toolkits and other stuff, materials.
Okay, I like how Dr. Ahed actually said that there is practical training. Yeah. Because it's one thing to be involved, like, you memorize and you know what to do in your head, but then you're faced with a bloody person. And it just reads, right? It's one thing to just shout instruction and not want to touch that person. So
it's very interesting educational material happening with American Heart. It's a revolution, I can call it. We saw the results. I have been supervising Middle East, Africa, and I have been in Russia. I see the interaction with the students more confident than in before. They said, this is interesting topics, the way how we can learn it. There is nothing like the typical instructor in front of you giving lectures. It's not there. It's all practice while watching and all enhancement and doing all the things by hand. So I found there's a lot of changes happening with them.
Well, that's good. Because again, it's the whole practical application all of these things. You don't just necessarily think, I know what to do. You should also be able to do what to do.
Actually, in addition to what I had mentioned, the manner of conducting the training is scenario-based. Okay, you'll be given a scenario.
What if there's a fire,
yes,
car
for example,
accident?
you are faced with a patient that say suffered a vehicular accident.
Yeah.
So you're given a scenario, you perform the skills based on that given scenario.
Yeah, like a broken bone here.
Yes. We also employ the mourage technique. Mourage is the science of making mock-up wounds. So you'll be facing a bloody patient, but of course those are special effects to enhance realism.
Yeah, we are doing a program called EMTB, Emergency Medical Technician Basic. And this is the first line for the EMS program on the pre-hospital setup. And this EMTB adopted from the ER-EMT, Australian Registry of the EMT. Myself as an EMT assessor for the ER-EMT. So we are conducting this program and we have something called triage. In the end of the 5 days, 6 days, it's a bridging course for the nurses to go through this program.
Triage.
Triage. So triage meaning is assessing the patient according to the highest priorities.
You have treated first.
You have more than 2, you have more than 3 patients victims.
And there's a priority
Yes.
of who has a big
There should be a
need
system, because if there's no system, people will be in chaos.
all over the place.
Sometimes people will be devoting more time on this particular
Yeah, 'cause
patient. All
that's-
resources are given here.
No, and that's the department of the families of the people who, I'm a mother, and of course, compared to I have something with my child, even if it's the slightest wounds, you know how parents can get. They say, no, we need attention now.
That's why there should
And
be-
apparently someo's dying over there.
That's why there should be a crowd control. So the non-medical person should be away from the patient.
Oh, good point. Okay,
Yeah,
so
crowd control is-
I'm a parent as well. I understand parents
Yeah.
out there, but let them do their job. Yeah, right? I'm wondering how, Miss Santi, how have people been responding to Cheers, knowing that there is a Cheers program? A lot of people go to you?
When we've started, they always say that, oh, it's okay, next time. But now that, when we want to be globally competitive, especially for our nurses in the Philippines, that, Dole said that there is no there is no employment right now for nurses because
the demand went down.
Yeah.
Exactly.
So this is the best thing to do now, nurses, for you to enroll in this class because you
Equip
will be-
yourselves.
Equip
Make your
yourself.
resumes look nicer.
You will be globally competitive. Not only that, you will be at par with the international standards.
Because again, of your international affiliation,
Yes,
like
yes.
what Dr. Ahed said.
So this is one of our vision before when we put up Cheers Corporation, that certainly from our country we will have to employ nurses locally and globally, and also to respond with our disasters here, because when we talk about disasters and when we talk
There's
about
so many here in the
so many
Philippines.
here. So this is the best
From landslides to floods.
Yeah.
And why should we always just rely on help abroad when we can help ourselves?
Yes, that's true.
It's right
That's
here.
basically right.
Correct.
So just in case people are interested, kung interesado po kayong matuto, where can we find Cheers website, phone numbers?
Okay, our phone number is 02, being in Manila, it's 02, error code, and then 413-9271. And we have a website that is www.cheers.gowideweb.com, so you could get information. Our location is, we are located at Quezon Avenue, very near High Top Supermarket. If you're coming from Mabuhay Rotonda, you won't go after EDSA, so it's between EDSA and Quezon Avenue, the corner.
It should be fun to go in a group.
Yeah.
Not necessarily just by yourself. It's nice to get a group of friends together,
Yes.
so you learn together.
Yes.
Right? Especially if you have families.
Working as a team.
Yeah, work as a team, teamwork. Thank you very, very much for your time. It's really good to know that organizations like Cheers is here, so that, you know what, we should take advantage
Yes.
of having people like you, so we're always prepared.
Yeah. Actually, there was a time that we had to do rescue team in Palawan during the Palarong Pambansa, wherein there was this injured player, and then they would not call medics or first aiders, they called Cheers. So everybody thought that, there was this thing to celebrate, so they say cheers, cheers, cheers. So everybody's clapping, and then we work simultaneously, smoothly, and no one even noticed that there is an emergency.
We
Well,
got,
that's good.
we got a very good experience in Philippines. The major experience that we faced here in Philippines is with Puerto Princesa in Palawan, with Mayor Hagedon. He adopted the enhancement the community to be integrated with the EMS. And this is, I feel it that it's a revolution, because he's following the same steps in Dubai, same steps in the States, South Africa, by implementing first aid kits and AED machines or unit in the public places, and he trained even the people who's working underground river. This is amazing.
Well, we can only hope that we can follow in that mayor's footsteps.
Yeah.
Every barangay
Yes.
in the country should have one. Para hindi na tayo iiyak. Because again, I just want to before I let these distinguished people go, you believe that everything's preventable.
Yes.
Not actually everything, but there are some things that you can prevent.
Yes. And if in case they do happen, you can still make the best.
Yes.
You are prepared.
You are prepared. you have
prepared for
equipment.
it. Okay, preparation rather than cure.
Yeah.
Thank you very, very much. We have more to talk about. Huwag po kayong aalis. Magbabalik ko po ang SheKa. Thank you, Dr. John.